And so this is just gonna be the last one now. Hey guys, welcome to my channel once again. My name is Omobeejay, and in today's video we'll be going through the postnatal check scenario in the midwifery OSCE. So if you've been following, I hope you've been finding value in the videos. And if this is your first video, yes, there are a host of other videos relating to the midwifery OSCE that you need to see. I'm not even lying to you. They are value packed, like value packed. So the playlist is going to be in my description, and there you can also have the card right at the top here for that. So without wasting so much time, I'm just gonna go right into it. We'll be reviewing the assessment criteria, and then we'll also go through like some form of acronym that you need to as a guide to inform the questions you ask the woman. So the first thing on here says cleans own's hand with alcohol rub or washes and dries hand following WHO guidelines. We know that already. So you're washing your hands according to the 7 steps of hand hygiene. Considers and discusses the woman's mental health and well-being. This should include appetite, energy levels, sleeping pattern, ability to cope with daily living, mood, anxiety, and depression, and family relationships. So basically, this already tells us like questions that we need to ask. So the first thing you're asking about the woman is a mental health and overall well-being. And you want to ask her, what's her appetite like, what's her energy level, what's her sleep pattern, what's her ability to cope with ADLs, is she struggling, is her mood, her anxiety, is there depression? Those are things you want to ask in the overall well-being. Then the next thing says considers and discusses the woman's physical health and well-being. This should include signs of infection, pain, bladder and bowel control, lochia, and perineal healing. So here we're not focusing so much on the meals, but these are things that you want to ask the woman, the physical health and the well-being. So the questions, the acronym for this is bubbles. I'll put it at the end and we'll discuss it at the end. So and that comprises of these things that are listed on here. So the fourth thing says considers and discusses signs and symptoms of venous thromboembolic disorders and identifies any risk factors. So you're asking the woman questions relating to DVT while you're doing your assessment. Again, I'll mention and show us the acronym that we use to ask these questions. Discusses the relevant aspects of infant feeding. This should include support and advice with position, feeding, attachment, and responsive feeding, and a consideration of breast tenderness or engorgement and pain management. So teaching the woman how to do correct positioning and attachment is important in this station. So you want to teach her that the mouth of the baby has to be wide open, and then it has to cover the areola, like at least much part of the areola as much as possible. And then you want to do the nose, tip of the nose thing. Accurately records the health and well-being of the woman postnatally and signs documents. So from here it looks like there's a document that needs to be signed. To be fair, I don't know what that document looks like. I didn't even know that you sign documents when I was practicing for mine. So yeah, whatever document it is, I think you'll be just fine. Just ensure that you write your name and you sign it and you document everything that needs to be documented. Effectively implements an evidence-informed care plan for the woman. Considers family support within the care plan. So it's important for you to consider family support, because this woman is postnatal. She can't do lots of things herself, so her family needs to be very involved in the care. So you need to mention that in this. I reckon the documents you'll be completing would also have something to do with like providing a care plan for this woman. So like that's already a hint for us. We have to ensure that there is family involvement and family support. Acts professionally throughout the procedure in accordance with NMC, the code professional standards of practice and behavior for nurses, midwives, and nursing associates. And that's pretty much the marking criteria. So yeah, the acronym is bubbles, BUBLS. Involves asking about the breast. Is it tender? the baby, is she lactating well? Is the baby latching well? Then the uterus, is the uterus involuting now? Is involution taking place? Is it bulky? Does she have any concerns? Then you want to go to ask about the bladder, the bowel, the pelvic floor. Is she performing Kegel exercises? Is there constipation? Is there diarrhea? Is she weeing okay? Does she have urgency or frequency? Those are questions you want to ask. And then you want to ask about lochia. What's the lochia like? How many days postpartum is it now? So lochia is a hill. How many days postpartum is it now? Is it as expected as it should be? Is she changing her pad frequently? How is she wiping? So from lochia to care of the perineum, actually. So you want to ask about the perineum. How is she wiping? Is she changing her pad frequently? Is there any foul smelling discharge or odor from the perineum? Those are things you want to mention. And then from there you go on to the S. Is there any swelling on the leg? Is there DVT? Is there edema or anything whatsoever? That's the S. Then advice, you want to tell her that her appetite comes over the overall well-being. So those are questions you want to ask in the overall well-being. Basically, that's pretty much the questions that you need to ask. The acronym is BUBBLES, B-U-B. I'll put it on the screen now. So appetite, you tell her to drink more, to eat little and often. If she says she has a reduced appetite, you want to tell her to sleep when baby sleeps. You want to tell her to accept help, accept support from her family, because at this stage is inevitable. You let her know that in as much as she thinks she wants to do it, she can do it and all of that it's only normal for her to allow family support even at this time. Yeah, like we mentioned and we saw earlier in the assessment, feeding assessment is also important. You want to teach the woman correct positioning of the infant to the breast, and then you tell her to support use this arm to support the bum of the baby. The head of the baby is here. It depends on which feeding style she wants to use, but basically it's the positioning and attachment of the baby's mouth to the breast that is the most important thing. Another important thing is she needs to ensure she's well supported, like, because you don't know how long the feeding will take. You don't want to be in an awkward position and then feeding is taking as long as it takes. So she needs to be well supported, have good support, and then position the baby in such a way that the baby is fine. Arms, the most common one is I think the cradle. The bum of the baby is just under her hand, the head is somewhere here, and then you do the chin to the nipple, and then the baby's mouth opens wide and the large part of it covers the areola. Then she watches out for swallowing. She should look out for dirty nappies and wet nappies. The baby should have 8 to 12 feeds in 24 hours, and she should last about 5 to 14 minutes. Baby will be weighed on day 5 again to see if the baby is losing weight, gaining weight. The baby will also have a heel prick test, and if she's bottle feeding, you want to tell her to sterilize her bottles to prevent infection, washing of hands, don't add extra scoops like I mentioned earlier. And yeah, that's pretty much the postnatal check scenario. If there are anything I remember or I didn't say, I'll put them in the comment section so you can go on there. You can also continue the conversation in the comment section as well. I hope you found value in this video, and I wish you all the best as you continue to prepare for your exam. Till you see me again in my next video. Wait, before we leave, have you subscribed? Have you liked? Sharing is caring, so please like, share and subscribe. Yeah, till you see me again in my next video, I remain your darling Omobeejay. Remain in God and God bless you. Bye.